Welcome to today's episode of Hear What I'm Saying. I'm thrilled to introduce a very special guest, Dr. Saya Obayan, a board-certified dermatologist and the founder of Nature of Skin Dermatology in Austin, Texas. Dr. Obayan is renowned for her expertise in treating hair and skin conditions, particularly those affecting people of color. With a holistic and personalized approach, she has transformed the lives of countless patients by addressing issues like hair loss, hyperpigmentation, and other complex dermatological concerns. Not only is Dr. Obayan highly respected in her field, but her work has also directly impacted my own clients, helping them regain confidence through effective hair restoration treatments. Her dedication to crafting tailored solutions for every individual truly sets her apart. Today, we'll dive into her journey as a dermatologist, the science behind hair loss and restoration, and her expert advice on maintaining healthy hair and scalp. Welcome to the Hear What I'm Saying podcast. I'm your host, Kenitra Stewart. Today we have Dr. Saya Obayan of Nature of Skin, located in Austin, Texas, joining us, a dermatologist, a bomb dermatologist, may I add. How are you today?
I'm doing great today. Thank you so much for having me.
No, thank you it's an honor to have you on the show.
Thank you.
As stated, you have helped so many of my clients restore their hair loss, and I'm just happy to meet you.
I'm so happy to be here. And thank you so much for sending your clients, too.
Absolutely. Yeah. I always, especially if I can't help, and I know someone that can help, I'm going to push them out. Like here. And it feels good to, have someone and know someone that can help, because you hate feeling helpless.
I know.
When it's beyond your expertise and you have no one that you can just refer out, you feel so helpless.
Absolutely.
And then it becomes this extensive Google search of no end at all.
Yeah. I mean, sometimes it's helpful. Sometimes you find someone, but you don't know too much about them. Mm-hmm. I've been in Austin for 10 years now.
Oh, wow.
And so I've been treating hair loss in Austin for 10 years.
Yeah, this is a great place to treat hair loss. It is. I know the clientele, the market out here, the demographic area, specifically for Black women too. It's really hard to find a dermatologist that can cater to, our specific hair loss or even skin needs,
Absolutely.
So it felt good to find you. Thank you, Fernella. Shout out to Fernella.
Thank you, Fernella. We miss you.
Yeah, we do. Can you start telling us a little bit about your background and how you, became a dermatologist?
Sure. Well, I was born in Nigeria.
Okay.
In Lagos, Nigeria, and immigrated here with my family when I was about 8 years old. Lived in Atlanta, lived in D.C., lived in Detroit.
Oh my gosh, you've been traveling everywhere.
Everywhere.
Mm-hmm.
My mother's a physician as well. She's a PM&R physician.
Oh, wow.
And so she really got me interested in medicine in the first place. When we were about 12, 13 years old, I used to spend time in the hospital with my mom because we couldn't afford babysitters. She was in residency. She got divorced from my dad.
Really?
Yeah. So we used to
y'all were living there.
We lived at the hospital. So all the residents took us under their wings. They showed us to patient rooms. They would talk to us about medical things. They gave me textbooks. And I fell in love with medicine.
That was such a great gift.
Yes.
Even through some of the unfortune, you gained a lot of fortune.
Absolutely.
Yeah. Oh my goodness, that's amazing.
Yeah.
How old were you?
I was about between the ages of 11 and 13.
Okay. Yeah. And you had siblings too?
I do.
Okay. And so they also had that same experience with you as well?
They sure did.
Oh my goodness.
Yeah.
Are you the oldest, youngest?
One of the oldest. So I have a twin sister. I have two younger sisters.
You have a twin?
I have a twin.
Oh my goodness. Oh wow.
But she said medicine is not for her. Mm-hmm. She does social media marketing. Mm-hmm. She's launching a really amazing inclusive dating app called Cupid AI.
Oh,
so she's in the middle of doing that. She lives in Puerto Rico. She's fabulous.
Oh, shout out to her.
She's fabulous. Yes.
Oh, man.
My sister Sola. I love you, Sola.
Oh, my goodness. Social media marketing. She's creating a dating app.
She is.
Oh, wow. How is that going for her?
I think it's a lot of work. Yeah. There's a lot of funding and angel investors she has to talk to. Mm-hmm. But I think she's finally done with the prototype, and I hope that she comes to South by Southwest next year.
Oh, to
and
like
launches
promote.
it.
Oh
Yeah,
my goodness.
that's my hope.
Yeah, that would be great for her.
Yeah.
That's gonna. Do they have any dating apps out there on the extent that she's creating with AI?
No, I don't think so.
No, this was like I've never heard of that.
Yep, and the technology is patented, so she's the only one that can have
You go,
it.
girl. She like, because this is mine.
Yes. AI, it's the next thing. It's the next big thing, right?
I love that. Yeah, it is. AI, social media, all of that.
Yes.
Absolutely. It's a great industry to tap into for sure. It's not going anywhere. I know there's this scare about TikTok, but I'm like, I don't believe TikTok is going anywhere. Yeah, it's too big.
It's too big.
You know, I just don't see it. But we'll see, but I just don't see it. What are the different types of hair loss, and how can someone identify the signs of each?
Okay, so there are two large categories of hair loss, right? There's non-scarring hair loss, and then there's scarring hair loss.
Okay.
So non-scarring hair loss is hair loss that can happen where it could be reversible. So things like female pattern hair loss, we also call that androgenic alopecia. Things like traction alopecia, which is from like braids and weaves. You send people to me for that all the time.
A lot of those.
Also reversible. But when it comes to the scarring hair losses, those tend to be more permanent.
Okay.
And they tend to have a little bit of a longer course than non-scarring hair loss. So they start out feeling like itchiness in the scalp, soreness, tenderness, sometimes little bumps in the scalp.
Yeah.
And then when the inflammation heals, the hair follicles permanently fall out and they don't grow back in.
Oh, okay.
Yeah.
And how did you describe that? I know that's scarring.
Yes.
And what else is that associated with? You know, while it's scarring, is that genetic?
Sometimes it is.
Sometimes it's genetics, right?
We know
if
that
it's not genetics, what is it? Like, what can cause scarring?
Absolutely.
Alopecia?
You know, I think at the end of the day, we don't have one solid answer for this yet.
Okay.
When it comes to certain conditions, scarring conditions, things like CCCA, LPP, these are very long words that basically mean you have small areas of scarring scattered on your scalp. That's LPP. Then when they start to coalesce or turn into a large area at the center of the scalp, that's called CCCA. So that's central, centrifugal, cicatricial alopecia. Scarring at the center of your scalp.
All the medical terms, they need to abbreviate, girl.
You gotta go to school to learn them.
Oh my gosh. And then also for y'all to remember these words. Then you gotta spell these words. And then you gotta know what they are, the structure, the function. It's like, my goodness.
Right. And then explain it to everybody in a way that they understand it.
In a way that they understand it.
So those types of hair loss, they have found a gene, a familial gene that can contribute to having this type of hair loss. They used to call it hot comb alopecia, but now we know it's not related to hot comb or heat.
Why was it called that before?
Because a lot of women of color were getting it, and so they were associating it with our use of hot combs.
Oh, wow.
But there are plenty of patients I have who've never used a hot comb in their life who are showing up with CCCA.
Oh,
so it's not only due to heat.
Yeah.
Some people think it's due to chemical relaxers and things of that nature. That hasn't been proven. That has not been proven yet.
Okay.
But what we think it is there's something called folliculitis or inflammation around your hair follicle. And when it happens over and over and over again, it leads to permanent scarring. Yeah.
Okay.
So you think about your scalp. The way I explain it to my patients at Nature of Skin is think about your scalp like a beautiful fertile garden that's growing all these beautiful plants. The garden is your scalp and the flowers represent your hair.
Okay.
So what happens with inflammation and scarring, it's like pouring cement into that garden. The flowers fall out and they'll try to grow back again, but more cement is poured into the garden. Wow. And so over and over again, that beautiful, beautiful fertile garden, it goes bare.
That makes so much sense. That's a good analogy to help the, patient understand.
Yeah.
Opposed to it, because the terminology can be wrapping your head around that is enough, But I love how you are able to come up with your own way of communicating to the patient so that they understand exactly, what you are trying to explain so it clicks. Because it's clicking for me now. So I'm like, oh, I can visually see now, So I love that. Look at you. What are some of the most common types of hair loss you see in your practice?
I think for sure, one of the top ones that I see in my practice is traction.
Traction.
So traction alopecia from braids, from weaves, from just leaving these hairstyles in too quickly, too long, can cause very significant hair loss.
Okay.
And then another really common one is androgenic alopecia, female male pattern baldness.
Yes.
Which tends to be more hereditary, more genetic.
Okay.
It usually starts at the temples and then spreads to the top of the scalp with thinning.
Oh, so is it at the temples and only at the crown, or does it spread, like it travels?
It tends to spread. So it'll start at the temples. You'll start to see it first at the temples, and then it'll start to involve the rest of the scalp, the top of the scalp.
Okay.
Yeah.
Oh, wow. So those are the top two that you see. How would you go about treating these?
So traction alopecia, it's really all about changing up those hairstyles.
Yeah. I bet that's so hard, huh? It's hard for them.
I have to negotiate with my patients sometimes because they'll come in and be like, Dr. Saya, I have this cruise coming up. I just want to do something. I don't want to have to deal with my hair. I want to go into the ocean. I want to go swimming. And so then we start the negotiations. Like, how long are you going to have it in here for? You can't keep it in for 8 weeks. So we usually... we usually settle.
Oh gosh, because I have it myself. That's why I'm laughing. After they come see you, and I'd be like, well, what did she say? And they said, well, and I'm like, well, go with whatever she said. I think they try to come to me to try to get another solution. I'm like, I'm gonna go with the doctor's orders, honey. I don't know that's why I sent you to her. I don't know what to do from here. So that's why I'm laughing, because I'm like, yes.
I mean, I get it. It's like really inconveniencing to have to like put in a hairstyle that costs a few $100s and then take it right back out. But I tell my patients that the most gentle hairstyles you'll find are more like the crochets.
Yeah.
Because your hair is braided down to your scalp. You're not dealing with single braids, right? Which put more tension at your root. And then you can take it out in 2-3 weeks.
Yeah. And it's not as expensive.
And it's not as expensive.
Yeah. So crochet. So that's a good one that I can tell my clients.
Crochets.
Okay. Any other ones?
Flat twists are fantastic.
Flat twists, but not cornrows.
You can do cornrows as long as they're loose and you don't keep them in for longer than, I would say, max 4 weeks.
Okay, that's not bad.
I don't think so.
Yeah,
I think that's a pretty good negotiation.
Yeah, it is. Especially, get you a unit, throw it on there. That even is more, cost effective.
Exactly.
Okay.
Wigs are great. I'm pro wigs.
Okay.
Wigs are a protective hairstyle.
Right.
Take care of your hair underneath it. Keep it flat twisted or loosely cornrowed.
Yeah.
And then you can rock your wig.
I love this.
Yeah.
Okay. We getting solutions here, y'all.
Yes. Always.
What signs should someone look for to determine if they are experiencing abnormal hair loss versus normal shedding?
Sure. So classically in dermatology, we say 100 hairs a day.
Okay.
So if you're starting to experience more than 100 hairs a day, then it could mean that something else is going on or something else is underlying. I would say in general, though, especially for, I think, people of color who might not shed quite as much as that.
Okay.
If you start to notice an uptick in general of your hair loss, that's a good time to go in to get treatment. If you start to notice significant thinning, especially at your temples or anywhere else on your scalp, that's a good time to go and try to get ahead of it.
Yeah. As soon as you notice some differences in your hair, like just go get it checked out. Do you, are there any patients that have admitted that they are afraid to come see you, like just having to accept the reality of what's going on, and then when they do come, it's kind of like it's that it's severe?
Yes. It's so it's so difficult because the most common patient population I have like this are my patient with locks. my patients with locks.
Oh, talk about that.
Yes.
Yeah, okay.
So like, I mean, you're investing years, decades into your hair.
Yes.
And you're proud of it and you love it.
It's a
and
journey
then it
for
starts falling
locks.
out. So a lot of my patients with locks take a long time to come into the office because, they don't want to be told that they'll have to cut their locks. Right?
Makes sense.
So my patients with the really, really long, really heavy locks, I do tend to recommend that they cut it because all of that weight is pulling at the hair follicle. And as the hair thins, the base of the lock gets smaller and smaller and smaller.
But
and then eventually
thicker,
falls
right?
out. Exactly.
And thicker at the bottom.
And thicker at the bottom.
Oh, and that's that weight
It's
from the lock that's like pulling at that follicle, damaging it.
Exactly.
Oh,
Yeah.
so when you advise them to cut it, what do they say?
Oh, it's pretty traumatic. I've had some pretty traumatic experiences.
Yeah, can you imagine? Because it's a journey, for most.
Yeah.
I've
had patients cry. I've had patients want to negotiate, kind of like, okay, can I still keep it this length? Can I do this? Can I do that? I've had some patients who've embraced it and just gone completely, short afro, natural hairstyles, dyed it, and look great. But it can take a little while once you've had that hairstyle for decades. That's your signature hairstyle.
Right.
It can take a while to accept it.
Yeah. And so once they do remove their locks, then they start treatment with you because there's no point in doing treatment if you're going to hold on to the locks because the problem is still just going to.
So listen, I meet my patients where they are.
Good. Yeah. It's hard, I could see the journey being really hard for them to not move forward with the treatment because of what they have to give up.
I know.
Yeah.
So I'll start treatment. I'll start things like topical steroids, injectable steroids. I know. Listen, it's nobody's favorite, but it's 5 treatments once a month for 5 months. And that really helps to stop the inflammation. That cement continuously pouring in the garden will slow down. And so you can retain more of your hairs.
Okay.
And then things like oral minoxidil, Rogaine, topical Rogaine. I compound like 5 different ingredients together, like Latisse, the eyelash grower, topical finasteride. I send it to a compounding pharmacy and they make it for my patients specifically.
Oh my gosh, that's why you have all these clients that are like restoring their hair loss.
Yeah.
Oh my, the science behind it all that you've intentionally taken upon yourself to like really learn how can we reverse this.
Yes.
OMG.
Yes.
I'm so impressed.
Oh, thank you.
Okay, so you send it off to, and like, girl, you got to walk me through this. Like, come on, tell me some more. Come on. I'm so excited.
So when a patient comes in to see me at Nature of Skin, the first thing I do is go through their history, right? Like, how long has the hair loss been going on for? Are you noticing it when you're styling versus when you're shampooing? Do you have any type of genetics, your family history? And then we go into kind of like stress. Because cortisol, the stress hormone, can facilitate or increase hair loss.
Okay.
So we got to get some stress management on board. I usually do that with supplements and things like discussing mindfulness and meditation. And then from there, we're talking about potentially doing a biopsy to confirm what the diagnosis is. So if it's something like scarring hair loss, I'm going to almost always do a biopsy.
Okay.
Sometimes I found discoid lupus when I'm not looking for discoid lupus. So you just really never know what's going on at the level of the skin.
I didn't even know you could find it in your practice.
Yeah. Yep.
OMG. I'm like, you gotta get some blood drawn. I didn't.
And I do labs too. I check your thyroid, your vitamin D.
I
check you for anemia. I check your iron, ferritin, sometimes copper. Sometimes I check your hormones, your testosterone, your estrogen, your progesterone. I'm checking all these things.
My goodness.
Yes.
I am just loving this. Oh my God. I had no idea, the extent that you, practice in order to help your clients. And I'm like, this is why you have so many great results, like so many good turnovers.
Thank you.
And they're so happy. Like, I'm so happy you found her. I'm like, Fernella found her. I thank God for Fernella, because I had no idea, that there was a Black dermatologist around here.
Yeah.
I do have a question about that. Is the approach different for people of color opposed to, European clients? Is it different?
For me?
Yeah. No?
It's not.
Okay.
I practice based on the diagnosis that I'm treating. So some of the treatment plans that I'll come up with might be, for instance, I might do more like an oil-based topical steroid for someone with like a natural, like curly, kinky hair.
Okay.
Then I might do more of like a water-based solution for someone with straight hair. So there's a finesse in the treatment plans that we're doing.
Okay.
But essentially, it's going to be the same thing for both groups of people. We want to stop inflammation, grow the hair.
Because my clients, whenever they've tried dermatologists in the past that were white, they just never had success. So I'm trying to understand, is the approach differently?
I think the approach might be different.
Okay.
I think really what it has to do with is training, residency training. So I was in a very comprehensive residency training. I was trained by an amazing dermatologist. Her name is Lynn Goldberg. She's out of Boston University.
Okay.
And she's also a pathologist. So not only would we look at hair in the clinic, we would look at hair under the microscope.
OMG.
And develop all these treatment plans.
Okay.
So I really learned from her. And from there, I just kept getting continuing education based on what I was seeing, what my patients were asking for.
Oh, okay. So it's all
learning.
About continuing education.
Absolutely.
In everything.
Oh,
let's
yeah.
be honest. You have to. Yeah. And so that's why I was excited that there was a Black dermatologist in the area, because it just seemed as though my clients could not have success unless it was somebody Black, So, yeah, I just felt helpless, before I saw you. I was like, I don't know. And they were prescribing like pink or this blue shampoo for clients. This pink or blue shampoo.
Ketoconazole.
What is that? Because I feel like it's like the most recommended, the most prescribed. Is it over the counter or is it prescribed?
So yes, over the counter it's called Nizoral. So it's like a 1%, and then the prescription strength is 2% ketoconazole. It's basically the same thing. But the reason I get so many complaints about it, I stopped prescribing it really.
Okay.
Is because it dries out curly hair.
Yes.
Even people who have Latinas, curly haired European descent, people all are complaining about dry hair. So that's no longer my go-to. I rarely prescribe that for the scalp now. Yeah,
because my clients would bring it in, and after I would shampoo, I'd be like, oh my goodness, like your hair feels so brittle. Like I want to follow up with something moisturizing afterwards, but I used to be so confused because I'm like, is it gonna mess up the treatment? That the doctor has prescribed for my client. I used to be like, I don't know what to do. I don't know what to do, but we gonna figure it out.
Ketoconazole is a mess. So like I love the shampoos that are more like zinc based now. They have zinc purothione as an ingredient. Selenium sulfide is another one.
Okay.
Some of my patients don't want to be washing their hair all the time. So we use sprays and lotions instead of shampoos.
Okay.
Yeah. So there's a lot of different things.
Girl, y'all better be getting this information. How important is early intervention when it comes to hair loss?
It is of the utmost importance. I think of hair like spun gold. And once it starts to come out, there's a chance that you might never get it back. So the earlier you get to treatment, the more hair you'll hold on to.
Okay.
And some of my patients get scared of treating with things like oral minoxidil and Rogaine.
Not me, girl. My hair started coming out. I'm like, what you need to do?
Do everything.
Inject my head. What do you need to do?
Spun gold. So, I really have to talk to patients and talk to them, negotiate with them about what they're willing to do. Like I mentioned earlier, stress is a big component of hair loss. So during COVID, I was seeing more hair loss than I'd ever seen in my entire career because of the stress. And so I started getting into supplements and things like ashwagandha, things like probiotics, things like turmeric. How do we naturally lower inflammation and stress in the body? And now I am embarking on creating my own hair loss formulation.
Oh, yeah. Do you have a name for it yet?
My Nature of Skin hair loss formulation.
Okay.
Yes.
All right.
Rapid hair growth formula.
When will this be available?
Likely within the next 6 months to a year.
Okay, good.
Yep. So check out our website.
Okay.
Shop natureofskin.com.
All right.
And you'll see it on there. Yeah.
Yes. Okay. That's some good stuff. Okay. And so these products will help maintain. Okay, gotcha.
And grow hair. So like there's so many different ingredients that we're just learning are helpful for growing hair. Some of them are from Ayurveda, Indian medicine. Some of them are from Eastern, like Chinese medicine. There's an ingredient called amla that can help to grow hair. It's an Ayurvedic herb. We already know about things like ashwagandha that can help to reduce cortisol and help grow hair that way. Saw palmetto is a wonderful ingredient for growing hair.
Yeah.
Then you've got Baringaraj, false daisy. That's another great one for growing hair.
Okay.
So what we're doing is basically taking all of these different ingredients that are in all these separate products and putting it in one place.
Okay. Oh my goodness.
Yeah.
I cannot. You said 6 months to a year.
6 months.
I gotta be on the lookout for that.
I'll send you some samples.
Yes, please do. I really appreciate it. I'm buying some too, though, because I already believe in you. I've seen what you can do.
Thank you.
So I'm already a customer, okay? Are there over-the-counter products or at-home treatments that you recommend or discourage?
It depends on for what issue, right?
Oh,
so we're talking about hair loss. Over-the-counter products that I love for hair loss, minoxidil.
Okay.
5%. People get scared because you have to do it forever.
Once you start, you can't stop.
Once you start, you can't stop.
I wouldn't even care.
So
so desperate.
So I would say that if somebody starts to notice like hair thinning, especially in that temple frontal scalp area, like I mentioned before, that's a really good place to start.
Okay.
But it's also important to just kind of go get your blood work done. Make sure it's not something internal like your thyroid, your vitamin D levels, or anemia. Those are the main ones. Other over-the-counter products I love. One of my major go-tos, if you come see me and you have flaking scalp, itchy scalp, dandruff, Royal Oils shampoo by Head & Shoulders.
Royal Oils.
It's a moisturizing anti-dandruff shampoo.
Okay.
People love it. My patients love Royal Oils.
I'm glad you shared that because my daughter's she's experiencing dandruff right now. And she actually, this morning, she woke up mad. She was like, I spent 30 minutes just getting these flakes out of she has locks, out of my locks. So I went and purchased Nioxin. If that doesn't work, I purchased it today. If that doesn't work, I'm definitely going to try the Royal Oil by Head & Shoulders.
Yes.
Okay.
They also have a spray. So if she doesn't want to be washing her hair all the time, get her the spray and she could spray it in between her locks.
Okay. All right. Got that.
And if it doesn't work, send her on in. I'm happy to see her.
Okay. Are you familiar with Nioxin? Okay. What do you think?
Over the counter? I mean, honestly, I don't recommend it very much.
Oh, come on. Tell me why. Oh, I need to know this information.
I mean, it depends on what you're using it for, right? You're using it for dandruff?
Yes.
So I haven't really seen a lot of success with it. I've honestly seen a little bit more success with the old school sulfur 8 than I have with like over the counter like Nioxin.
Okay.
So I like anti-dandruff solutions that are like zinc-based. I love selenium sulfide. Those are great. Sulfur-based is also good for the people who want to stay kind of holistic and natural.
Okay.
Sulfur-based washes and soaps are good too.
Okay.
Yeah.
Oh my goodness. Because I have an older colleague, I guess you can say, and she does not recommend Nioxin.
Why is that?
She just feel like it's for my daughter. She's like, maybe once she gets older, but not now because her scalp is so premature, for those reasons. But she didn't say necessarily it didn't work, but I did notice we got the scalp recovery serum for my daughter. It worked in the past, but this time it's not working. So that's why I went back and got the shampoo and the conditioner.
Interesting.
So I'm like, maybe I need to pair these together to see what it worked. But if it don't work, I'm just going to go try the Head & Shoulders.
Try it. What's the active ingredient in Nioxin?
I don't know yet because I've never really used it. Yeah. So I just was going based off of a recommendation.
Sure.
And then when I was discussing it with my colleague, she was just like, no, don't do that. And then I interviewed a trichologist and she said, yeah, it's good. I don't know.
Oh, really? I guess it depends on the person, right?
I guess
and the individual.
I don't know.
I'll say 2 other things that I tend to see flare scalp dandruff. one, getting braids or just freshly twisted locks.
Yeah.
The tension tends to trigger inflammation, and the inflammation shows up as dandruff.
Okay.
And then two, people who are eating a lot of sugar-based foods. So if you're eating a lot of carb-based foods, if you're eating a lot of sugary snacks, sodas, candies, and cakes, those folks do tend to flare more too.
She been eating a lot of that stuff lately. That's probably her problem. Because it just can't. She was doing well for like, I think roughly like 6 months. And then it just flared back up maybe like a month ago. But I know, and I told her
that was around the holidays.
Yeah, and she, ever since she got those braces removed, she just be going to town with all types of sugar. Just, girl, like, golly. Like, should we put the braces back on so you can practice good oral hygiene? This girl, her oral hygiene is great, but she do like sugar, so.
Yeah.
We'll see.
Around the holidays, I think we all have some sugar issues. I know I certainly do.
Yeah,
I like me some pumpkin pie.
Yeah. The braces are saving me right now. I used to be a big candy person.
I am too.
Yeah, but these braces and the way how stuff like the wrap is so aggravating, I just like, no. If it gives me problems eating it, I don't eat it now. So I'm more for like mashed potatoes, mac and cheese, anything mushy. So it don't require a lot of chewing and I can just swallow and move on.
Oh my goodness.
It's a struggle.
Wow.
I can't wait to get them off so I can eat.
When you getting them off?
They don't know yet. I have like this, they say unique case. So they're even documenting it. So
oh wow.
Yeah, so unique. And it's because like one of my laterals didn't grow in. So they're having to like recreate and shape my anatomy.
Oh wow.
So yeah. So they're like
extensive surgery.
Oh yeah, I've had 3 oral surgeries so far.
Wow.
Yeah, I have 1 more.
Oh my goodness.
Yeah. But before this, you really couldn't even tell. It was just because my teeth started slanting to cover that space. So you couldn't even tell that that tooth did not grow in. Yeah.
Wow.
And then when they started moving my teeth around, I'm like, oh my goodness, it's so prominent. Can y'all please fix this? Can y'all please hurry up and fix this problem? So, but he said, I think September.
He'll be done with everything.
Well, the oral surgery.
Oh,
yeah, the oral. But as far as the braces, I don't know.
Okay.
I'm just praying. I'm just taking it up with God.
Well, positives is you're staying away from sugar.
Yeah, that is. Yeah, I have been eating so much better since I've, had braces. And the ortho even told me that he was like, at least you'll be healthier. He was like, because I'm telling you, a lot of foods that you probably like to eat, you're not going to want to eat them because it's just going to give you so many problems. And he was not lying. Like, I just like, nope, I don't want to have nothing to do with it.
Wow.
So it's a gift and a curse, I guess. Yeah. What role does diet and overall health play in maintaining healthy hair or preventing hair loss? If you want to elaborate and extend more, we would love to hear.
That's an excellent question. Because at Nature of Skin, the whole ethos or philosophy behind my practice is that we are approaching skin conditions and hair loss in a holistic way. And so that's why I do talk about things like what we're taking in, what we're consuming. That's why we do talk about things like stress, because managing those two things can actually also help improve not only our hair loss, but just our overall health and wellness.
Oh, okay.
So I always talk to my patients about anti-inflammatory protocol and staying away from inflammatory foods. So inflammatory foods are going to be absorbed into the body. They're going to be seen as glucose, as sugar. They're going to increase certain levels of other hormones that then can facilitate hair loss. And so things like sugar, white flour, refined starches.
Oh, good.
Animal dairy. So milk, cheese from animals, sometimes even red meat and saturated fats or fried foods. Those are the main 5.
Oh.
Yes.
Oh, I got a lot of reading, girl. Ooh, my food chart is terrible. It's
Because
terrible.
part of it too is we know that we have this whole thing called a gut-brain axis.
Okay.
And our gut is where a lot of really good neurotransmitters are produced. It's bacteria produce, I think, about 80% of the serotonin in our bodies.
Oh, wow. Okay.
Yes, and they're all in our gut.
Okay.
And so what happens when we're eating more of these inflammatory foods, these sugars, these dairies, and all that, is we literally change the bacteria that grow in our gut. And they start producing other chemicals that are not so helpful for us. And other things that are cycling back to the brain and being seen as inflammatory, cycling into the skin, causing acne, cycling to the hair, causing hair loss.
OMG.
Cycling to the brain, causing brain fogginess, mood issues, things of that nature, causing bloating in the stomach. So all of those things, all of those things are connected. Our body is a system that works together. And so what we put into our mouths, what we put into our minds can actually show up on our hair.
Absolutely. It's so sensitive, hair is. Even the skin, it responds and reacts to everything that's going on in your body.
Does.
And I always tell my clients, if you are experiencing unexpected hair loss, go get blood work. You just never know what it is.
That's really important.
Mm-hmm.
That's a really good point.
Yeah, it is. Especially if you don't get chemical services and you don't even wear braids. I always be like, check your blood work. One of my clients for 3 months, she was like, my hair is thinning. I don't know what's going on. I told her, go get some blood work because I don't know. Your scalp looks great. You know, your hair is growing, but it is thinner. And I think it took about 3 months for her to get that blood work. But then she brought up Ozempic. And I was like, more than likely.
That might be contributing.
I said that's probably where the issue is.
Yeah.
But I think also encouraging the client to go get blood work, I think that's hard for them because they don't want to know what if it is something, something bigger than my hair.
Yeah.
Like lupus.
Right.
Because I do wonder, why don't you go get the blood work? Let's see what's going on so we can hurry up and give, provide a solution.
Right.
And I do wonder, like, what is it? I have to listen, go get the blood work done. I told her 3 months ago.
Yeah.
And she was like, I still haven't done it. And I said, why? She's like, I don't know. I just haven't done it. And I do wonder, since you are a doctor, I'm like, do you believe it's something emotionally, triggering?
Definitely.
Yeah.
Absolutely.
When you stated that earlier, I'm like, now it's making sense to me why some of my clients will not go do it sometimes whenever I recommend it.
It is, I think, I think there's just been a lot of mistrust of the medical community.
Yeah.
Sometimes within our communities, right? That's a big part of it. And that's historical. So it's like, am I going to be seen? Am I going to be, taken seriously? Am I going to be brushed off? I have so many patients that come in and say, I went to this office and they just brushed me off. They said I would just have to deal with this for the rest of my life. And that was 20 years ago when they could have actually done something about their hair loss.
Oh, I can see that.
Yep,
so
that's a big part of it.
Yeah, and I didn't even think to that extent. So I'm glad you did bring that up because I'm thinking it's maybe just a health concern that they don't want to know about, that they have to now adjust to a different lifestyle.
Yes.
But when you brought that up, that is definitely a great POV for sure.
There's definitely that. There's fear. Right?
Yeah.
Like, what are we going to find out? What could be wrong with me? I don't really want anything to be wrong with me.
Yeah.
There's that. There's a fear that they're going to potentially be ashamed. I think there's a lot of shame that comes in when we start losing our hair.
Yeah. Absolutely.
A lot of patients think it's their fault. So there's that wrapped up in there. And I have to really explain that this is genetically inherited or this is related to your thyroid disease.
Right.
And if we can get ahead of that, then we can retain some of these hairs.
Absolutely.
Yeah.
All righty. So now we're going to shift to, I guess, tension alopecia and hairstyling.
Okay.
For people experiencing tension alopecia, what are some of the key causes and how can they prevent further damage?
Number one is not doing back-to-back tension hairstyles. So don't braid your hair back-to-back. Don't do your full weaves back to back. Make sure you're constantly switching out your hairstyles. That's really the most important piece. Find some good protective hairstyles you could rock like at least 50% of the year.
Yes.
Whether it's a wig, whether it's flat twists, whether it's loose cornrows, whatever you want to do. Twist outs are beautiful and great.
Yeah.
So just find some hairstyles to kind of like rotate through.
Yeah.
You can still have, you know, some braids from time to time, some weaves from time to time. Keeping them in for a shorter amount of time is really important. So I tell my patients 4 weeks.
Yeah.
You get 4 weeks with this and then switch to something.
It's about balance. Right. Yeah. Yeah. Because constantly incorporating those hairstyles that causes so much tension. It's like that follicles never get a break.
They never get a break. I mean, I'm sure you see it all the time. You see a lot of traction, right?
Oh my goodness.
What do you tell them? Like, how do you get them to stop doing it?
Girl, how do I encourage these clients to stop? It depends on the client. You know, some clients, they receive it and they will stop. But then I have others who are just so afraid of, you know, they just don't know how to do their natural hair. So they steer away from it.
Yeah.
You know, they will wear those styles back to back.
Right.
And I think just instilling the fear, honestly, you know, I hate to go that route.
Yeah.
But I have to, you know, I have to present the worst case scenario in order for them to move forward with, you know, what I'm, you know, advising them to do. And sometimes it works, sometimes it don't. Sometimes I never see them again because it's not what they don't want to hear that.
Right.
And I understand that too, you know, but I feel as though if you really want a solution and if you really want to move forward, whatever that goal is that you have in mind for yourself.
Yeah.
If you truly want to accomplish that goal, then you have to take those sacrifices. That's just life, period. You know, in order to reach the bigger goal, it comes with some sacrifices that we all don't like to. We don't like to do, you know?
It's the truth.
And then I try to even use that too, you know, like whatever goals that you have for yourself right now, you know they come with these small sacrifices that we just absolutely hate to even, you know, walk ourselves through, but it's going to be for the bigger goal. And that's what's most important. And it's for a short term. You know, I try to help them also understand this is for a short amount of time that feels like forever. Yeah. You know, but once you get there, you can be like, it really wasn't that bad. You know, it really, once you reach the goal, you know, it's worth it, you know. So just constantly consulting, encouraging, trying not to be discouraging. But sometimes they hear you differently too. You know, you have no control of it, you know. So sometimes only a very small percentage don't come back. And then you have some that are like, yeah, I'm going to do this. I don't care. Whatever it takes, I'm going to do it. You know? I'm sure you probably see that too.
All the time.
Yeah.
Yes.
Yep.
All
you
the
have
time.
the solution right there. All you got to do is meet me halfway. Come on. Come on.
Yeah, I see the resistance all the time. It's kind of like, you know, somebody is on like trying to get on a weight loss journey, right?
Yeah.
And they know they have to do certain things to get to the end goal of that journey.
Yeah.
Same thing with hair loss.
It sure is.
Once it started, it's a journey to kind of get you to your goal. And you must be willing to put in the work and put in the effort and sometimes the discomfort of getting to that goal.
And it's very uncomfortable. And it's also the uncertainty because I've had clients to say, what if it don't work? And I'm like, it's going to work. I've seen it work. You know, the only time it won't work is if I need to refer you to a doctor on my end. You know, when I can help you, I can help you.
Yeah.
But other than that, I'm going to refer you out and I'm going to be completely transparent about my, you know, expertise, whether I can help you or not, you know. But if I'm 100% sure, all you got to do is just take my hand.
Yeah.
And let me guide you along the way, you know.
That's very sweet. Yeah. We're on the same team.
Yeah, we are for sure.
We're in this together. Yeah.
Yeah. Is it necessary to stay away from certain hairstyles like braids, flat twists, or foundation styles for wigs during treatment?
Yes. And I'll tell you why. It's because every single time I see my patients, we take photos, and it's the same photos every time. We take a front-facing photo, sides, top, back. And when people have extensions in their hair, I cannot I can't objectively tell you whether your hair is improving or not. And not only that, if we have to do steroid injections, I can't see the areas that I need to inject. So you're not getting the amount of care that I would normally provide for you because extensions are covering up your scalp.
That's right. So will they arrive that way?
I've had to tell some patients, listen, I can't do your hair at all. So sometimes they come in with the piece. I don't know what it's called when you do the net and then you
that's sew in with the net.
The sew in with the net.
You can't see anything.
I can't see anything. So I have to reschedule them. I tell them I can't. There's nothing I can do today. Keep using your topicals. Keep taking your pills if you're on pills, and then let's schedule you back from when you have those out of your scalp. Because otherwise, I can't help you today.
No, at all. So what about when they're trying to negotiate? Okay, we started treatment. They come back. You rescheduled them. We started treatment. They come back. Their hair is free. And you start the treatment. And then later on, they do want to get those braids. So they can get the braids as long as they're loose in the flat twist styles. Okay. Okay, just want to make sure because I need this advice from my clients.
Yes.
I'm like, okay, I heard from a doctor you can do this now. So, because I just want to make sure that they stay, the course and make sure that they get those results that they are, seeking.
Exactly.
And I don't want to be the one to steer them in the wrong direction and then mess up the entire treatment plan that you have organized for them. Exactly. Okay. I just want to make sure I'm hearing that correctly.
Short term, loose braid, loose cornrows, flat twists are okay.
Yeah.
I think the safest hairstyle if you're going on vacation is a cute crochet that you take out after 2 to 4 weeks.
Yeah. Okay.
Yep.
Got that one. How can someone balance their love for protective styling while experiencing hair loss? The ones that aren't going on vacation and, that love to keep their hair protected because they don't want to, have to manage their natural hair. How do you find a balance for those during treatment?
That is interesting. I think a lot of my patients, I have a handful of patients who stay in wigs.
Okay.
Like they don't really have significant hair loss. They just have a little bit of thinning, but they're just more comfortable putting the hair away because then that way they don't have to take care of it as much. And I'm actually fine with that. So what they usually do is I always like my patients to wash their hair before they come.
Oh, yeah.
Right? At least a few days before. So that I can really get a close look at the scalp. I can part the hair. I really get in there. I'm looking for inflammation around the follicles. I'm looking for flakiness. So my patients who keep their hair braided up underneath wigs, all they do is just take it out a few days before. They come with it to the practice. Then right after they leave, they do their thing again so that they can keep wearing their protective styles.
Okay.
And I don't have too much of a problem with that. I know there's kind of like an old wives' tale, like you should let your scalp breathe and all those types of things. I find that the scalp gets oxygen through wigs pretty easily. It's a net and there's a lot of air kind of like rotating in that area. I tell my patients always never sleep in your wigs. Do not glue your pieces down unless you have some kind of important event and you want to, do that one time, take it off the next day.
Right.
Because the glue itself can cause the hair to fall out.
Absolutely. Yes. Especially for the frontal wigs. Whenever they glue those
lace
down.
Fronts.
And you'll notice like there's the perimeter from ear to ear is gone. Is that scarring or is that tension? What type of alopecia is that?
I would say it's kind of more in the traction family because what's happening is that glue is getting pulled off over and over and over again. And along with the glue is going to come some hair.
Okay.
And the more often, you're installing these wigs and taking them off over and over again, the more hair you're going to lose.
Okay.
So you'll see a lot of actresses, Hollywood stars, performers who wear installed wigs. They don't have a hairline anymore.
They don't, no.
Yeah.
And it's really smooth as if like, like if you have like and you can correct me if I'm wrong, it's like it feels like an active follicle because there's some texture there. But what I've noticed is theirs is smooth. What is that?
The hair is completely gone.
Is that scarring?
Sometimes it's scarring. If it's
Okay.
flat and shiny, so
Yeah, flat and
scarring,
shiny.
the
Yes.
shininess is scarring.
Okay.
Yeah.
Okay.
Not to be confused with another type of hair loss called frontal fibrosing alopecia
Okay.
that causes scarring throughout the front of the scalp, and that is
Mhm.
an inflammatory condition,
Okay.
right? But then you can also have trauma to the scalp that causes scarring too, with the bonding
Okay.
glues and things like that.
Okay. Ooh, child, I'm in class. You hear me? Oh my goodness. I guess you've answered this one too, where we say, do you have any advice for stylists on creating styles that minimize the risk
Oh,
of hair damage?
yeah, definitely.
Yeah.
I mean, it sounds like you do a really thorough job, counseling patients, making sure that they're not keeping their hairstyles in too long, talking about tension. That's really the one of the most important pieces is
Okay.
being able to counsel your patient, your clients on how often they should be getting this hairstyle. When you're starting to see signs yourself of hair thinning at the temples, especially thinking about traction and telling them to take breaks. Say, let's switch to this, less low tension hairstyle. Let's switch to something like flat twist. Why don't we switch to something like a twist out?
Yeah.
Or
for
do a
sure.
blowout,
Yeah.
rock your hair like that for a while.
Yeah, that one right there. None of my clients want to rock that blowout. Unless it's
we're in
like
Austin,
a press.
Texas.
Yeah, unless it's like a press. I have maybe one or two. They'll come and they be like, leave it froed. Like I'm good to go. Yeah, they'll rock that fro. It looks so good too. But not a lot of them. They be like, I'm not dealing with this. When I leave you, what am I supposed to do with it?
You turn it into a twist out, add some foam, add some curl styling cream.
Yeah.
Turn it into a twist out. Yeah.
I think the maintenance, is a lot for especially my clients. It's just so much maintenance, so much upkeep, so many things to remember, so much information out here on social media too.
Yeah.
Whether it's great information, whether it's misleading, and I believe there's a sense of overwhelming too.
It is overwhelming. It's a lot of information. It's from all these different sources, and you don't really know who to trust.
Yeah.
I think we all have this little person inside of us with so much wisdom.
Yeah.
I think a lot of us know when these things are starting to happen. Whether or not we choose to listen is a different thing entirely.
That's right. Ignoring, not wanting to sit into the reality too. That's true. I'm guilty of some of it.
Aren't we all? Are we not all?
Yeah. Yes, indeed. What myths about hair loss do you often encounter with your patients? Are there any?
Myths about hair loss. I think one of the most common myths that I still comes up in my practice today is people think that if they cut their hair, it'll grow faster.
That is such a myth. It's the biggest myth
Thank
ever.
you.
It's the biggest myth.
Thank you. There's still people coming in thinking that they cut their hair, it'll grow faster.
No. I tell them what's happening is you are removing your dead ends and now you're retaining length.
Exactly.
That's it, and now your hair is growing, at a rate that seems faster when you are just cutting your dead ends, and it's very minimal now because you've been taking care of your dead ends. So now it just seems like you're holding on to so much hair because you're getting rid of the dead ends now. And then they be like, oh, I'm like, yeah. But it ain't gonna help your hair grow faster. That's not biology, so that's a good one. I'm glad you brought that up.
Yeah. I'm shocked that it still comes up, but it still comes up.
Yeah, it sure does. Yeah.
Some people think that flakiness of the scalp, dandruff, is contagious. Like they could give it to somebody else. I've been asked that several times. Yeah.
Are there any scalp conditions that are contagious?
If it's a fungal infection, it can be, like little kids in school often get ringworm of the scalp, and they get these circles, these patches of hair loss. That can definitely go to somebody else. It's actually highly contagious.
Okay.
You can also get it from your pets at home, your dogs and cats and things.
Okay. Okay, I'm glad you addressed that. Okay. Are there any other myths?
There are a lot of things going on about things like rice water.
Oh, talk about the rice water, girl. Come on, please tell them about this rice water myth.
So people think that using the rice water will help their hair grow. And rice water is not necessarily something that helps your health grow. It's more of a strengthening thing. So when we're reducing breakage, it's going to look like our hair is growing because we're retaining length, but it has nothing to do with the rice water making the hair grow. And I'm sure you talk to so many people about this.
Yeah, but a lot of people still don't know.
Yeah.
Because you can go on YouTube and it's still being promoted, as if it's this miracle hair growth. And like you said, it's like a restorative.
Yes.
It's not a hair growth product.
Yeah.
That's right.
It's like a protein treatment.
Thank you, ma'am. That's exactly what it is. It's restoring lost protein. That's it. I love that. Can hair restoration treatments like PRP or hair transplants work for everyone, or are there limitations?
That is a wonderful question, actually. It's one of my favorite things is taking patients who have hair loss and have tried all these different treatment options for their hair loss and nothing's worked, and doing something like PRP. So for PRP, platelet-rich plasma, is when we draw your blood, we spin it down to the platelet layer, and then we inject it back into your scalp. And sometimes I'll combine that with things like microneedling, which is a pen that has 36 micropins in it, where I make channels in the skin. And then I drizzle the PRP in, massage it in, as well as inject the PRP.
Yes.
So it's like 2 treatments in one. I have had really good success with patients with early scarring that have come and done PRP because PRP reduces inflammation and grows hair at the same time.
So those results are probably pretty quick.
Yes. 3 treatments. Takes 3 treatments once a month for 3 months. And then usually by that 3-month period to about 6 months, we're seeing improvement. Sometimes it's as soon as the second treatment. But I love those treatments. And I'm bringing on a new treatment into the practice that's tattooing. So I'm going to be tattooing medications into people's scalp.
How do you do that?
I have a tattoo machine and I have a tattoo needle that actually will draw up medication into it. And then I tattoo the medication into the scalp. And that way you avoid systemic side effects. There's no side effects of the medications. You do have to do it pretty regularly, like every month for 3 to 6 months. And then kind of every quarter for maintenance. But there's no pills needed. No pills at all.
Oh my, you are just so innovative. Oh my goodness. I have never even heard of that. Is that a practice?
It's new. It's a new thing. So I think it was developed maybe about 5 to 10 years ago. I learned about it from a dermatologist named Carlos Wambier, who's wildly innovative in the space of dermatology. And so it was developed by a Latin American doctor. I believe he's a hair transplant surgeon. And now we're Carlos is bringing it into dermatology.
Oh my gosh.
Isn't that cool?
It's amazing. It is. I mean, it's really cool like stuff. All of these, my clients, they already have success stories with you, but depending on the client and what they need and whatever, I guess, treatment that they're more comfortable with, they have so many options. It's just not like this one thing. So I like that too, like just knowing that they have so many options that they can choose from, depending on, I guess, how aggressive, how not aggressive that they want to, approach it, So I'm like, I didn't know it was so many options.
There are so many options. I think the first thing that people say, a lot of my patients say when they come in is, I really didn't know that there were so many different ways to treat this hair loss. I was told that there was nothing I could do. And so it just brings me great joy when I can say, hey, you can do one of these 5 things. We can start here. You still got these 4 other options. We're going to work together. It'll be a 6-month to 1-year thing. And we can just kind of monitor your progress and work together.
One thing my clients love about you is you start treatment same day.
Yep.
They love that. That's the most feedback that I receive from them, that they love. They're like, she was on it day one. Instead of let's see what this and this and this and this. And they're like, no, it was like right then and there.
Yep.
Yeah, I love that too, because now you feel like you can really step into that journey of fixing whatever the cause is.
Absolutely.
Yeah, that's the feedback I get all the time from my clients. Like they be like, she get right on it.
Yes, because guess what? Time is hair. The more we wait, the more hair we lose.
The more hair we lose. Yeah.
So I'm on it.
Time is hair. I love that. Yep. What are some warning signs that should prompt someone to seek professional help for hair loss?
That's a good one. We talked about a little bit of that increase in hair shedding.
Yes.
That's more common with like the non-scarring hair losses, visible thinning.
Okay.
Symptoms, so symptomatic scalp, whether it's itchy, whether it's tender, whether it's red, whether it's flaky. Those are really good signs to look out for.
Okay.
I think a lot of people know when they're starting to have hair thinning once it's very visible, but not everybody is paying really close attention to their hair in the beginning. So it can be easy to miss it.
Yeah.
It can be easy to miss it.
Yeah, because it's like a gradual thing. It would be different if it all decided like, oh, we're going to all fall out today. But I bet it's like hair strands just at a time in different places on the head. Is that how it works?
Yeah.
Yeah, and that's probably why you can't see it.
No.
Yeah.
So a lot of people say, oh, my partner said this, or like my friend saw that, or whatever. So sometimes it's someone else having to see that change to have them come into the office. Yeah.
Yeah, I referred one of my clients to you. She was experiencing some thinning in the crown, and you helped her. And she didn't even know. She had been getting braids, and no one told her. And that was her first time coming to me. And I told her, I was like, I don't know if you've noticed or anyone around you has noticed, but you have some thinning in your crown. And she had no idea. Yeah. And then I gave her your information and she started coming to you. And she good to go now.
Well, isn't she lucky that she came to see you though?
Yeah.
Some people don't say anything at all.
Yeah, she said no one had informed her.
Wow.
She had a color service done. Wow. She was wearing braids and no one told her that she was thinning in her crown. And I was like, oh, don't worry. I got a solution, honey. Don't you fret. Here, go to her. Go to her. You will be good to go. And then I had one client, she came to me and I noticed that her texture in the crown was different from her perimeter. And I asked her, I was like, I thought it was like maybe a density situation. Like, is your hair higher density in the crown and lower and around your perimeter? She was like, no, I was experiencing some hair loss and this grew back in, this texture just grew back in differently. And I was like, oh, so who helped you? And it was me. It was you. This lady's out here saving lives. What is this?
One scalp at a time.
Oh my God.
And that's CCCA too for you. And when people start to present with CCCA, that baldness at the top of the scalp, it usually presents as breakage. Like they complain that their hair is starting to break off.
Oh no.
At the center. And that means that there's inflammation already in the scalp that needs to be treated. But that's early. That's considered early, so you can still save the hair.
Okay. Yeah. I'm learning so much. So much. Is hair loss reversible?
I would say many times.
Many times. Okay.
Not always.
Yeah. In what cases it's not reversible?
Usually the longer the time has passed, the less likely it is to be reversible, because even things that we do like PRP, if it's been 20 years that you've had this, you're a male, you have male pattern baldness and you're trying to bring your hair back, but it's been 20 plus years, the PRP is not going to be as effective as say 5-10 years ago for you.
Yeah.
So it's all about how long it's been. With scarring hair loss, it's about the degree of scarring. So once you see that, you've seen that shiny skin, right?
That shiny skin.
Once you start to see a lot of the shiny skin, that hair is unfortunately probably not coming back.
Because you don't see a follicle.
Exactly.
Yeah, and so that's why whenever I would see that, I always wonder, can this be reversed? Because you don't see any signs of any follicles there. And I'm like, without a follicle, there's not going to be any hair that can come through,
What's really interesting is that I've had some cases of scarring hair loss that I thought was never going to come back, right? I was like, this is a Hail Mary. Let's do this PRP. Let's do this microneedling. I'm very clear with them about setting expectations.
Yeah.
But this patient really wanted to do this. And what I ended up doing was pairing the microneedling with the PRP, where it's kind of like aerating a lawn, right? You're puncturing, making these little channels in the skin, and then putting in the PRP. And lo and behold, her hair grew back.
Oh my goodness. And
From
that
being
was you
completely
just
scarred.
trying something.
I was just trying the microneedling with the PRP. We did 3 treatments and the area fully grew back.
Oh my goodness.
So happens with some patients, doesn't happen with others.
Oh my
And it's hard to
goodness.
predict who it's going to work for.
Yeah. Oh man, at least there's an option to just try.
Yeah.
You know, so at least that's that, you know, versus like, girl, it's nothing I can do. I can't help you. Do you see any males in your practice?
I do. I see a lot of males. Yeah.
Okay. All right, cool. I was just curious because, you know, of course, my clientele is predominantly women.
Yeah.
So I was wondering, like, what percentage of men do you see opposed to women?
Sure. I probably see about 25%.
25%.
Men.
Yeah. Mm-hmm. And they're trying to save their hair.
Yes.
Oh, okay.
Yes.
Are they predominantly black, white?
I have a very, very mixed male patient base. Okay. They are a combination of African American, Latino. I have a good amount of sort of like Middle Eastern Persian patients as well. And then I have Asian patients too. Okay. And I also have Caucasian patients. So the male population at my practice is actually quite diverse.
Okay. That's good to know.
Yeah.
Everybody don't want to be bald. So
it's a universal shared experience.
Right. Absolutely. Are there specific ingredients in hair products that people should look for or avoid to support healthy hair growth?
That people should look for or avoid.
Definitely that avoid one.
Definitely the avoid one. Absolutely. Yeah. What should you avoid in your... Well, I think a lot of hair products now don't contain sulfates.
Okay.
Right? So sulfates are kind of harsh on the hair, dry out the hair. Yes. So people are avoiding sulfates. I'll be honest, there's this trend towards including things like essential oils.
Oh, let's talk about that. Yeah, come on. Girl, I was on that trend. Come on.
There's a trend with including all these plant-based ingredients. And listen, my practice name is Nature of Skin. Right. You know I'm plant-based. I love all the plant-based things. But a word of caution is that plants are biologically active, meaning even things like aspirin. We got aspirin from a tree bark. A lot of our medicines come from plants.
Right.
So what that means is that when we put something on our skin or we put something in our hair, we could get a reaction to it.
Okay.
And I'm seeing a lot of things like lavender, lime, bergamot, citrus, essential oils in our shampoos, conditioners, lotions, creams that I'm seeing people react to. I had a woman come in with a rash all over her face, all over the back of her neck, and told me she just shampooed her hair.
And it spread.
Oh, yeah. Well, she shampooed it and the shampoo went down her face and all that. Within a day or two, she was red. She was flaking. She had a really significant rash.
Oh, my goodness.
And looking at I went through her allergy list. One of her allergies was Brazil nuts. And so I look on the shampoo bottle and lo and behold, one of the ingredients is Brazil nut extract.
Oh, my
Why it was in her shampoo, I don't know. But I would say when it comes to the products that you're using, it's better to lean towards some of like the simpler things and not the things with like the 30, 40, 50 ingredients, you know?
For sure. Yeah. I agree.
Lean towards things like moisture, be looking for things like aloe, glycerin. Those are great humectants that pull moisture into your hair.
Right.
You know, look for soothing things. Like if they want to add things like niacinamide, that's very soothing to the scalp. All those things
really
are great
sticking
for
with
the
those
scalp.
core basics.
Oh, yeah. Keep it simple.
Yeah.
My hair spritz mixture I recommend at the practice all the time is basically about 2 ounces of vegetable glycerin, 2 ounces of aloe vera juice, about 6 ounces of water, 20 drops of oil, shake it up, mist it once a day.
Yeah.
We're good to go.
Very moisturizing. Yeah. Yeah. And a simplicity. Just being minimal.
Yes.
You know, it changes a lot. You know, I feel like when you overdo it, you send everything into overkill.
Exactly.
You know? Like,
keep it simple.
Keep it simple. And because it makes it more complex and also discouraging.
Yes.
It's like, I don't want to have nothing to do with all of that. You know, like, Even whenever it comes to just a basic hair care regimen that I'm recommending for a client, it'd be like, well, I saw on YouTube, I should be doing this, I should be doing that, and I tell them, just listen, get you a clarifier. That you're gonna do that once a month, and then you're gonna follow it with moisturizing shampoo and a moisturizing conditioner, and you're a good leave-in.
Okay,
and keep it moving.
What are your favorite ones?
Oh, Redken.
You like Redken?
I love Redken.
Okay.
Redken and Biolage. So far, those are my top 2 favorite. Because they're so gentle on the scalp too. And what I've noticed since a lot of clients have been, since we are transitioning to wearing our curly hair now, it tends to be quote unquote drier, even though it's just sometimes the texture of curly hair, versus when it was straight.
Right.
There's no resistance. You have these curls going in different directions, so it creates friction, and then it gives you the illusion that your hair is dry, So those Redken is my go-to for sure. The All Soft Curls line, and then they have a acidic bonding concentrate line. Okay. So it can keep that pH level of that hair and that scalp, at its normalcy, So those are my top 2 for sure. Yeah. There are others out there that I haven't tapped into that I hear a lot of great reviews about, but that's it.
What do you like for low porosity hair? Because I see that in my practice all the time.
Ooh, low porosity. I always tell my clients, it's a struggle to have low porosity hair, but it's also, to me, the most healthiest because it's so resistant. And it's not prone to receiving a lot of things that can be damaging to the hair because that cuticle is so shut closed. It's so stubborn. So I would say I still recommend Redken. Okay. It's all about adjusting the water temperature. Okay. And because the warmer the hair, it'll lift the cuticle so that it can receive that moisture from the product.
Got it.
And so but I always tell them it's really great to have low porosity hair. It's less prone to getting heat damage because the heat can't penetrate the medulla to alter the curl pattern and make your hair want to stay straight, Okay, all right. So I always try to encourage them to embrace, be happy you have low porosity hair. It's not a bad thing. Just adjust the temperature of your water so that you can so that the hair can the cuticle can lift so they can receive the product, and that's really it. I just it's mostly it also depends on the density. The higher density clients, those are the ones who struggle the most to me. And the lower density, even though they have low porosity, it's easier for that product to receive moisture. When the density is higher, it shrinks a lot, to the scalp. And the curls tend to be tighter.
Got it.
And so that's what makes it hard. I tell them, be very intentional whenever you are shampooing and conditioning your hair.
Sure.
Don't just throw that shampoo on the hair and just, you have to be very intentional. Whenever you are conditioning your hair, take the time and work that conditioner through. Don't just throw it on your curls because they are traveling in different directions. And some of those curls aren't going to get some of that love.
Right.
So you got to be patient and section that hair off. And
I love that.
Yeah, just section it off and really work the product through for low porosity hair. Work the product through. I have low porosity hair and it's high density too. And I just work that product through. It takes time. It do. It tests patience.
Just be patient with yourself.
Yeah, you got to be patient and make sure you do your hair on a day where you have nothing to do so that you can give it the love, intention, and care that it needs.
I love that.
Yeah, because low porosity hair, I don't want medium, I don't want high, and I definitely don't want high. You don't want high, So be happy that it is stubborn because it takes a lot to break it down, So I try to tell them that. And then when they receive that, and they're like, it's not even that bad. After all, I don't really have bad hair, That's why, the information that's online is so discouraging. I'm like, it's not a bad thing to have tight curls, to have shrinkages. Right. Also, it's a great sign of great hair health when your hair's shrinking, So I try to encourage them to know that these are really good benefits for your hair. That means the integrity is in great shape.
I love that. I love that message.
I just try to help them embrace what they have.
Yes.
And then for my high porosity clients, unless because high porosity doesn't necessarily mean that it's damaged, it could be chemically treated. And we just make sure we change the hair care regimen to hair products that are chemically related to chemically treated hair. And that's it. Like it's so many solutions out here that are complex when it's really simple.
Wow.
Yeah. That's really it.
That's fantastic.
Yeah. But that's all I have today. I really thank you so much for carving time. I know you're busy because I reached out last year.
Girl, last year, the last 3 months of the year are the busiest.
Yeah, I reached out last year, and your assistant told me reach out at the beginning of the year, and we should be able to jump on the podcast.
I was like, I'm going to do it.
Yeah, I was so happy. Girl, I ran.
I love talking about this.
I ran and told my family. I was like, she's going to be on the podcast.
I love it. The more education that we can do in our communities, really, the better.
Yeah.
And this messaging needs to come out like over and over and over and over again, so as many people possible can hear it.
Yeah.
So thank you for even having a platform like this where people can learn and feel safe,
that's
get
what
resources.
That's what it was created for.
Yeah.
Exactly what you just said. Yeah.
I love it.
Yeah. How do our listeners find you? How do they connect with you? How do they stay in touch with you? And we need to know about, because we want to know about this product in a year that you're creating. So we need to know how to stay in contact.
Absolutely. So you can reach me on Instagram. I'm at Dr. Saya Obayan, Dr. Saya Obayan, on Instagram. And then on Facebook and Instagram and TikTok, it's at Nature of Skin ATX.
Okay.
If you want to email us, you can email us at contact@natureofskinatx.com. And our phone number is 512-312-7552. So feel free to call us if you'd like. Thank you so much for having me.
You're welcome. Thank you for tuning in today's episode of Hear What I'm Saying. A big thank you to Dr. Saya Obayan for sharing her incredible knowledge and insights on hair loss and restoration. Her expertise in dermatology and dedication to helping individuals reclaim their confidence is truly inspiring. I hope you found this conversation as enlightening as I did. If you'd like to learn more about Dr. Obayan's practice or the treatments she offers, be sure to check out Nature of Skin Dermatology in Austin, Texas. As always, thank you for listening. Don't forget to subscribe, leave a review, and share this episode with anyone who might find it helpful. Stay tuned for more conversations that inspire, educate, and empower. Until next time, take care and keep shining.